Humanity First Guatemala was first established in 2010 and since then expanded to multiple humanitarian programs. These include Water for Life, Learn a Skill, Disaster Relief, Gift of Health, Gift of Sight, Gift of Knowledge, Our Kids, Our Future, Masroor Ahmed School, Nasser Hospital, and the Women's Health Program. The Humanity First Women's Health Program began in 2014 from a collaborative effort from HF Guatemala and female professionals from the U.S. The Women's Health Program began with gynecological preventative and treatment clinics, which still continue today a couple times per year and have also expanded to indigenous communities in Chiapas, Mexico. Cervical cancer is the #1 cause of cancer-related deaths for indigenous women of Guatemala and the surrounding areas, including Chiapas, while at the same time, it is the most preventable cancer. However, most of these ladies have limited or no access or knowledge about this threat.
Mi abuela me la enseñó ser comagrona. Después estudié. He atendido como 7,000 primigesta, pero ahora sí ya no nos dejaron.
During our gynecological camps, we also conduct menstrual workshops to local students in order to empower them. In these workshops, we teach students about ovulation and the menstrual cycle, provide 2 pairs of reusable, environmentally friendly menstrual underwear, and discuss the importance of self-esteem. Each reusable menstrual underwear costs an average of $7 and can last over 5 years. A simple cervical screening can detect cervical cell changes and prevent progression to cancer. This can save the woman and protect a family. Therefore, we provide free education on various pertinent women's health topics such as domestic violence, mental health, women's cancers, and STIs, and then provide cervical cancer screens while also checking for other gynecological issues. We also provide free treatment on most diseases. An average of 70% of women that come to our clinics have a pelvic infection, and an average of 10 to 15% of the women that we screen are also positive for cervical cell dysplasia per admission.
En mi caso, yo que soy mamá soltera, entonces habiendo más apoyo, la verdad me motiva más a seguir adelante. Aprendí demasiadas cosas también. Me han dicho algunas cosas sobre sí el tema, pero aquí como que me implementaron más, me dieron como que más información, ¿verdad?
During these years conducting preventative screening and educational clinics, we also regularly gather research through questionnaires to better understand the population of women being served. Through our research and relationships with the communities, we learned that up to 80% of indigenous women deliver at home with comadronas, or traditional midwives, that traditional midwives who accompany their patients in the hospital are usually treated with discrimination, and that 1 in 5 indigenous girls deliver their first child before the age of 18. We found that the comadronas were under-equipped with the tools necessary for effective prenatal care and safe delivery, and most did not even take blood pressures or own a stethoscope. In June of 2018, we launched the Midwives Save Lives program to provide midwife kits and empower midwives from 4 different villages. These midwives kits include a digital baby hanging scale, an adult weighing scale to measure the weight gain of the pregnant mother, a measuring tape to measure the girth of the pregnant mother to ensure effectiveness of the maternal nutrition sponsorship, a stethoscope and a blood pressure kit, a bulb syringe, scissors, a fetoscope, a headlamp, and a washable mattress pad, all included inside an HF duffel bag. In our first Midwives Save Lives program, we were able to give 15 midwives these kits. Each midwife kit can cost as little as only $100, which is only $10 a month for effective prenatal care and safer delivery. Any fundraising after that will go towards the costs of safe births at Nasser Hospital. Malnutrition and developmental delays in children under the age of 5 is a major problem in Guatemala. Guatemalan mothers will breastfeed longer than 2 years in order to conserve food. This takes a tremendous physical toll on the mother and baby. Therefore, along with Midwives Save Lives, we launched a sister project that allowed each midwife to choose one needy pregnant mother to provide daily prenatal and postnatal nutritional shakes. It only costs $23 a month to provide a vitamin shake every day to one of our selected pregnant or breastfeeding mothers. We hope to sponsor each mother for a total of 2 years from her first semester until the infant is around 1 year old. This price includes providing a small amount of the supplemental drink to the infant after 6 months of age.
Tengo 15 años y es mi primer bebé. Aprendí mucho porque como es mi primer bebé, entonces yo tengo que saber cómo alimentar a mi bebé desde mi vientre. Pues me siento contenta porque yo soy una persona de pocos recursos y para mí esto va a ser una gran ayuda.
Before, we were only able to refer these women to other clinics for cryotherapy to remove the cervical cancer lesions. However, with your support, we now plan to treat these vulnerable mothers at Nasser Hospital. The Maternal Child Sponsorship Program is already changing the course of the lives of 15 pregnant and breastfeeding mothers, but we need your help to continue to sponsor them either through volunteers fundraising and joining us abroad or through donations only.
And I would definitely recommend to anybody who's on the fence about doing it or not doing it to just go for it, because you might only get this chance once, and you get to help somebody that's in need, and it's totally worth it. I am very happy I traveled to Guatemala with Humanity First. It was very scary for me because it was the first time being out of the country. The whole Humanity First team has made me feel super comfortable and super happy, and it's such a great experience.
I'm really impressed with this program. It's my first time here, but when I was starting, I didn't know what I was going to expect. But when I came here, I saw that it's a really good program, and the way I saw the ladies today when we gave them out the equipments and everything, it seemed like it's a really good program. It's going to be helping so many people.
With all of our programs, we keep one objective in mind: that educated and healthy women and mothers are the cornerstone for any society's successful future, and that we have a responsibility to lift up those around us. Please join us in letting us continue running all of our women's health programs and giving these vulnerable women, mothers, and infants a chance to be healthy and empowered.
In order to buy the supplies and for everything else, for this work, you need financial help. So even if you can't come, at least give donations, and definitely time to come out and do volunteer work here. It's certainly going to help, and you will see so many cultures. You are coming out of your country, you're going to see a different part of the world which you have not seen before, and you will get an idea of how the other half of the countries of people live like.
There's always more work to do in the service of humanity. Follow our work and journey on Twitter and Instagram at HF Women.